The Healthy Measures Initiative wants to upgrade Europeans' health system. What are the main challenges of healthcare systems in Europe nowadays?
The main challenges, I think, are quite well known. First and foremost, it's demographics. So we have an aging population in pretty much every part of Europe, and with that comes an increased demand on various health systems for all kinds of conditions, whether they be lifestyle related or conditions that go hand in hand with the aging process. And what follows on from that, of course, is that we have a growing chronic disease burden in Europe. Now, non-communicable diseases are pretty well controlled at a European level. The data suggests it's quite flatlining. But when it comes to chronic diseases, and those linked to lifestyles in particular, mental health issues, obesity, diabetes, and so forth, there are serious spikes in pretty much every part of the EU. So when we take those two together, we see an increasing burden of demand and pressure being brought to bear on health systems. Now, what also comes off from there is that we have serious considerations about the economic or the financial sustainability of health systems. We see it played out in almost every national election, that additional spending is required simply to maintain current service delivery at the level that citizens expect. But with growing populations, aging populations, and increased demand for services, this is becoming ever costlier. And with patient expectations about receiving the best quality medication they can for pretty much any condition you can imagine, the cost of providing medicines, the cost of adopting new technologies, both diagnostic and prognostic, is increasing across the board. And so pretty much every government in Europe is struggling with the financial sustainability of their health system. So when we take that together, we also look at some other trends that could also constitute opportunities. And I think one of those is a significant shift in patient expectations or citizen expectations about what their health systems should be providing for them. So I think we can see that there's a shift towards personalised medicine and a willingness for European citizens to play a more active role in the management of their healthcare. And in that sense, there's a real shift as well around the technology landscape, which is starting to enable this. But of course, to create a pan-European technology landscape which supports more sustainable health systems is a very complex and difficult matter. And of course, when we look at the European landscape, we have to recognize that some countries such as Sweden or the Netherlands, the UK, are pretty advanced on this journey already, and others are really not. So we have big inequalities and disparities in terms of the maturity of health systems. And at a European level, we want to try and reduce those. The challenge is, how do you bring in effective policies and structures that will enable that to happen?
It seems as the European health systems have a health problem, they have an economic problem, a financial problem. How could technologies help Europe to overcome these problems?
I think the kind of technologies will generally be around digital infrastructure and data infrastructures. I think we know from the European science and technology landscape that there are breakthrough developments being made in imaging, in artificial intelligence, in robotics, and lots of other advanced industrial applications that will potentially transform the nature of hospital treatments and surgical interventions. But more broadly, if we want to create more sustainable systems, then we need an enabling infrastructure and environment that allows better exchange of knowledge and information, not just between care providers and hospitals, but also between the public sector and the private sector, between the research community, particularly biomedical research communities and healthcare providers. But of course, we have to ensure that patients and insurers and payers, essentially all of the key stakeholders within the ecosystem of health in Europe, have a say in the way that these infrastructures are being designed and developed. So I think we're going to see that there is a huge increase in the medical devices, personalized medicine, and the digital domain, which is going to generate an unparalleled amount of data for healthcare providers, policy makers, and decision makers within industry. The question is, where is the investment going to flow? What are the priorities going to be? And how do we try to make sure that the technologies that are adopted are somehow connected within Europe? So even if you take the case of artificial intelligence, it's one thing to have a set of diagnostic algorithms around a particular condition, but if they're being employed in different ways and with different machinery and equipment in different parts of Europe, then the data generated is unlikely to be interoperable, comparable, and ultimately utilizable.
So is it just about interoperability, or is it about standardization, or even lifting up health policies from national to the European level?
Health has not traditionally been considered an EU competence. It's really something that has been very much held at member state level. But of course, when you look at the 28, hopefully soon to be 28 member states in Europe, the design of their health systems, the allocation of responsibility and budgets and decision making on technologies, medicines and other medical services is incredibly fragmented. Large steps that have already been made by the European Union around data privacy, the GDPR being the classic example of this, but also attempts to start putting in place a digital health infrastructure into which all member states will start to align different components of their health systems. And I think one of the first great examples of this is the European patients' records, which are now enabling the exchange of pseudonymized patient data between member states.
What could Europe do to promote a more patient-centered and outcome-centered healthcare system?
So I think the European Union has a huge role to play in this, despite the fact that historically it has not been so active in health policy. One of the areas that it can do a huge amount to advance our understanding of the value of outcomes-based approaches and the potential benefits of smart health in Europe is through research. And as you would know, the EU is in the process of negotiating its next multi-annual framework programme for research and innovation. There's a large cluster which will be dedicated to health. And I think it's highly important that the EU allocates some of its research budget and includes in the broader research priorities better evidence gathering about how innovations in health systems based on outcomes and moving patients and stakeholders to the centre of decision making should really factor in. I think the other area where the EU has been successful so far and could be successful in the years to come is in promoting common standards about what we should measure. So they have worked, the European Union has worked closely with the OECD in recent years to come up with some common performance indicators around health outcomes. They've also been quite actively involved in supporting the work of ICHM, the International Consortium on Health Outcomes Measurement. ICHM is a very relevant agency to consider in this landscape because they have developed standard sets of metrics to measure outcomes around 26 different conditions, which I think cover about 60 to 65% of the disease burden in Europe. So we now have new standards which can be commonly applied throughout Europe, which in turn would reinforce this, this ambition of having more interoperable, comparable data, and would then basically help to support the digital infrastructure that Europe can also invest significantly in, whether it's through Digital Europe or through other instruments, so that we have a European landscape where health data is being used in all parts of the continent to inform better health decision-making.
Do you think that it is necessary also to involve people into designing these kind of smart future healthcare systems? And how could this be done?
I think the inevitability is that if we are to develop more sustainable health systems, Patients and other stakeholders need to be at the heart of these decision-making processes. They have to be actively involved in consultations, not just about the types of services that can be provided by governments or health agencies, but also how they will become more active participants in the digital realm and how they can more effectively use their own health data to improve the quality of their care and their engagement with health services over a period of years.
Are you aware of any kind of concerns or myths that might hamper the dissemination of smart health technologies, and how could we deal with these kind of negative feelings about smart health?
It probably falls into 3, maybe 4 different categories. The first is that we still have a classical model of healthcare delivery. Right, so within the medical community, I include research as well as clinicians and practitioners in that, we still have a lot of the old architecture, which is about vertical specializations and very narrowly focused treatment processes and interventions. So there is a certain resistance within the medical community to take more holistic or transversal approaches. I think the second is skepticism about the role of industry and whether or not a more active role in promoting health technologies is a backdoor to increase profits and to charge higher margins. The third, inevitably, is about citizen awareness and the idea that you are the owner of health data that can be used for a whole variety of different purposes, not simply shared between you and your doctor, but also potentially with commercial companies or even in other countries, right? Cross-border data transfer of medical data and records. This is quite scary to a lot of people. And although I think increasingly the European Union and national governments are working towards very effective and robust standards to protect this and ensure the anonymity and privacy of citizens' data, if you don't understand that landscape, it's also quite scary. That's where the emphasis on health education and literacy, digital literacy in particular, will come into play.
A quite substantial share of healthcare costs, treatment costs, go into treating diseases, sicknesses, illnesses which are caused by lifestyles, by habits. Do you think that smart health technologies will be able to change these habits regarding nutrition, regarding your lifestyle?
When we look ahead into the next 5, 10, 15 years of health in Europe, and smart health in particular, we're likely to see an increase in remote healthcare consultation and service delivery. I think we're likely to see a rapid increase in small-scale micro-technologies within the home to enable people to manage existing conditions and get feedback from health systems in a more timely and effective way. And I hope that ultimately the explosion in social media and device applications will actually encourage a mindset amongst different generations to make better lifestyle choices.
In the past, health data was generated by doctors, by nurses in hospitals, so at places where we have a special and trustful relationship to. In the future, health data will also be produced by ourselves, by our remote sensors at home, with our smartwatches, so it will be a dramatic increase of health data. What about data privacy issues, and what about surveillance? Are these concerns that people share just myths? Are they afraid of something which is not relevant at all? Or can you understand certain concerns that this data might be abused as well?
Oh, I think there are very valid concerns about how this gargantuan amount of data that will soon be flooding the market is going to be handled, and who will take ultimate responsibility for its protection. I anticipate that the majority of health data will be somehow streamed into national agencies or public agencies. That will require a different mode of cooperation with big technology companies and social media companies, for example, or the manufacturers of devices. I think it is a responsibility for politicians across Europe to be facilitating the kind of public debates and consultations about how this model can work. And at the heart of it is a question of trust and whether citizens will continue to contribute to this census if they believe that the data is being mismanaged.
Will new healthcare systems, will smart health and digitalization also require new skills from nurses, practitioners and surgeons?
I think it's going to require a significant investment in skills development. First of all is understanding the potential of digital technologies and smart health applications to improve the efficiency of managing patients' experiences within health systems, and also the data analytics that will underpin decisions within a healthcare provision environment.
Do you think that a broad application of artificial intelligence and even predictive medicine might also lead to a situation where qualifications are no longer needed, human qualifications, qualifications of doctors, and might get lost?
No, in a nutshell. I think there are certain areas, in fact there is existing evidence that in some areas, such as the application of artificial intelligence in the interpretation and analysis of chemotherapy imaging or cancer diagnosis, is more effective than the time that a clinician or a surgeon or a specialist will spend looking at images and data. And I think in certain conditions or in certain fields of medical science that will become the norm, in part because it then liberates the professionals to spend more time on the actual intervention and treatment and not so much the diagnosis. But I think if I reflect on all of the events and discussions that we've had in our Healthy Measures initiative, one message comes through again and again around digital health, smart health and new technologies. They can never replace the human relationship between a healthcare provider and a patient.
You mentioned that doctors and nurses might have more time because some of their work might be replaced by digital technologies. Do you really think they will have more time, or will there just be less of them because of the costs?
If you take the example of the UK, to give one instance, the huge pressure is on the general practice system and the availability of consultation slots and people going to general practice for pretty much any condition. I think if you have a digital health environment or a smart health environment that allows more self-diagnosis or virtual support systems, remote support systems, you hope that this reduces the pressure on the bottom of the pyramid, and it's a huge bottom of the pyramid, which in turn then allows, I think, better primary or initial interventions, which then reduces the burden of demand on the more specialized areas of treatment, in particular clinics or hospitals. One of the great areas of potential for smart health is on predictive and prognosis. And the more that these applications and technologies become widely adopted by citizens, the greater the possibility is that they no longer run to the primary care services to have their condition treated.
How is responsible innovation understood in the healthcare sector?
Well, there are significant questions around the use of data, for example. So what do large-scale partnerships between the public sector, between the scientific community and industry look like? How do we create an environment where more data from clinical trials is channeled, for example, into open access platforms and not purely used for competitive purposes? I think given the emergence of this very diverse and dynamic startup landscape in Europe, the provision of access to data is going to be one of the key areas where health companies, be they on the equipment side or the pharmaceutical side or the insurance side, are going to have one of their biggest challenges, but also one of the greatest prospective contributions to responsible innovation.
Innovation can come in very different shapes. It could be a new technology, a new product, but could also an innovation of the whole system be a responsible innovation? So is the object of the innovation, the healthcare system as such, a case of responsible innovation?
Well, I think within the Horizon Europe programme, as with various other clusters, not just the health one, there will be quite a lot of emphasis on systems transformation. It's very common rhetoric these days at European level, but I think there's a sincere commitment to try to understand what some of the trigger points are that can be activated through research and innovation to start to effect a change in mindsets, a change in structure, a change in cross-border collaboration and partnerships. But if we take a step back, the question about health system reform has to also be explored through, for example, the successor to the Innovative Medicines Initiative, or IMI2, as the iteration under Horizon 2020 was born, because that was one of the few successful examples of bringing together, in particular, the pharmaceutical industry, all of the major players and the industry associations, with leading scientific bodies, with national agencies, with member states, and with patient forums and other stakeholders, to look at how you share needs, how you share concerns, how you address some of the issues of responsible innovation in a multi-stakeholder context. And I think whatever format the next health-oriented partnership takes, it's very clear that the European Commission will want to see the participation of the full spectrum of health industry actors, not just pharmaceutical companies, but devices, imaging, big tech, big data companies, and more. So I think that these modalities are vital. If we're going to talk about the future of health systems, there has to be an effective forum where people across the board feel that they can come and discuss in a non-competitive way the kind of long-term policy commitments or collaborative projects that might trigger reform and change and improved outcomes for all of the participants in health in this kind of European context.
What wishes, what expectations do you have regarding the new European Parliament and the new European Commission?
So I think there is a growing sense that health has such universal relevance for all citizens of Europe that there needs to be perhaps a rethink of how it is positioned within the broader European policy landscape so that it is a transversal competence in the way that sustainability or sustainable development was moved up the hierarchy and the political agenda in recent years. So in the years to come, I think it would be a great step forward if we see different policy areas, different clusters or missions or fields within the European research landscape begin to adopt health as an integral part of everything that they do. So that would be one. I think the second is to continue to support the work that's being done with OECD and others on advanced metrics and standards, and to invest a lot of time and energy in persuading or encouraging member states to adopt those so that there is genuine prospects for comparable analysis and data exchange throughout the EU. So I think this question of standards and common metrics is enormously important. I think a third priority for Europe has to be on the digital infrastructure side. And there is obviously a lot of money which is indicatively going to be invested through the Digital Europe programme, through structural funds and elsewhere, to build up this interconnected system for member states and for European agencies to be more active in managing health data and facilitating cooperation between member states. And I think actually one other component which is going to be very important, to come back to an earlier point, is going to be the skills and public awareness, which kind of goes hand in hand with all of these. As we go through a transition whereby European citizens become more responsible for their own health data and its use, we have to make this a positive narrative, this a journey of opportunity and discovery. It's not something to fear.
Thank you very much.
You're welcome.